Okay, firstly, if you just remove the cap from the end of the syringe and then just press down gently on the plunger, the gel will start coming through. Then what you want to do, you're just placing a small amount of the gel around each of these teeth, so it's just a small blob on the outer surface of the teeth. Okay, so we're not placing it on the biting surface, not on the inside, just the outer part. You'd work around each of these teeth, and then once that's all in place, then you would place the tray. So you simply line up the teeth and then push upwards, and the tray is seated in place. Once that's in, if you just very quickly press around each of these teeth just to spread out the gel, and then lift up your lip and just check that you don't have gel coming out from the edge of the tray here. If you do, you can wipe it away either with your finger or with a wet cotton bud, okay? And then when you've completed the whitening for that session, any part of the tray, you just gently lift that away, remove the tray, and then you can rinse your mouth either with warm or cold water. So with the whitening trays, each day when you're doing it, ideally you do it once a day, and if you can wear the trays for 2 hours at a time, that's the optimum time. Recommend a minimum of an hour.
Okay.
Any time of the day is fine. Ideally, I'd suggest, if possible, try not to brush your teeth for at least about 20 to 30 minutes either side of the whitening.
Okay.
As I mentioned, you can rinse your mouth with normal water after you've finished. Ideally, you do this every day if possible. You get better result that way. And if you can avoid food and drink with a lot of colouring, so things like tea, coffee, red wine, basically anything that would stain a white top and be hard to get out, so things like tomato-based foods, beetroot and so forth.
Okay.
The more you limit it, you will get a better result with it, okay? With the whitening, the one main side effect some people find is you might get sensitivity in the teeth, okay? If there is mild sensitivity, you can use a desensitizing toothpaste to help settle that down. If it's anything more than that, if it's more severe, if it's persisting, you feel like you're having to take painkillers, anything like that, then do let us know, okay?
Okay.